Guys, welcome back to Medical Coding with Blue. Today's episode is all about some jobs to avoid as a brand new medical coder. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got this comment. I'm gonna read the comment and then we're gonna get into it. So here we go. So the viewer says, it can be extremely frustrating when an organization puts out videos stating that you may need to find a front desk job to get your foot in the door. That's something you tell us not to do. So I have done this video quite a few times already, talking about the jobs to avoid. Now, little disclaimer first. The reason that I'm telling you guys to avoid these jobs in particular is because it does not exercise your skill as a medical coder, or it doesn't utilize any of the training that you have as a medical coder. Or if it does, then that organization, that doctor's office, that facility, that provider, whatever, whoever you're working for is going to use that skill basically for free. And you should never work for free, especially when you are trained, okay? Now, there's a little bit of psychology how they put this, like there's an organization, I'm not going to say the organization it is, but there's an organization that puts out videos that says, hey, you know, you may need to look at getting a front desk job just to get your foot in the door. The psychology behind that is if you apply for this job and you get this job, okay, you got a job. You're getting in. You've got your foot in the door. And then, of course, you can go and you can move about in the organization. But sometimes this is not always possible, especially if you do a really good job in that role, then they're going to want to keep you in that role. And it is really difficult to get strong, competent people sometimes to work the front desk. And sometimes, you know, if the patients really love you, they're really not going to want you to move. So because of that, you know, they want to keep their golden goose wherever that golden goose is at. All right. So the way that you need to navigate getting your foot in the door, everybody's going to ask for experience. Everybody asks for experience, 3 to 5 years experience, 3 to 5 years experience. And they say they want a CPC, they want a CCS, they want all of these other credentials. And nobody asks for the CPCA. That is not true. That is not true. I see them ask for that all the time. Nobody asks for CCAs. That is really not true because I see that asked for a lot too. So whatever credential you have, if you have one of the 4 main medical coding certifications, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC. If you have any one of these, because all you need is one. You don't need more than one, okay? Because then you're going to start overlapping with what competencies you're tested on, okay? So you just have one and you're out there and you're applying. You need to apply for coding positions. If you want to be a coder, then apply for coding positions. Now, yes, I've done jobs, alternative jobs on where to start and things like that. That's going to help you to use your skill. But again, this video is talking about the jobs to avoid. All right. So if you want to be a coder, you're going to apply for coding positions regardless of how much experience they're asking for. The ones you want to avoid: medical secretary or secretary front desk. If you get hired in an organization, you say, well, I'm going to get this secretary position and they're going to let me code. They're not going to let you code, okay? They're using your skill for free because that secretary position, front desk position is not going to be paid the same amount as a coder. So you're giving away your skill for free. And why? In an industry that can pay you. I don't have to tell you guys how much money healthcare makes every single year. Healthcare as a whole is a $1 billion industry. Healthcare as a whole is a $1 billion industry. Let that sink in. So if you have skill, if you are trained, if you are a certified medical coder, avoid those positions like secretary, front desk. Well, Blue, I just want to get into the organization. Then you find another way. You find another way in another position that is going to capture utilization of your skills, not something that is not going to capture your skills, because those positions are not going to require you to have all of this knowledge, right? your medical terminology, your anatomy, pharma, pathophysiology. It's not going to require all of that, right? It's going to require you to have good personality and organizational skills and that kind of thing. That's what that's going to require you to do. So you're going to be essentially not utilizing your skill, right? If they don't have you doing coding, or they don't have you looking at codes or whatever, of course, they're going to be having you do other things. How many of you, be honest with yourselves, how many of you, if you got into a position like that, would actually come home from the work day and actually continue to work on the workbooks? I guarantee you, not a lot of people. Because people are going to say, well, I tried to be a coder, I couldn't get my foot in the door after only applying for a few positions in coding, okay? And then they want to look for those coddling positions like entry level. Oh, I'm seeking an entry level. Every job you get is going to start entry level, okay? Until you, of course, you get experience, and then you get in advanced positions and things like that. You get into more positions that are going to require a lot more knowledge, of course, like lead medical coder, or CDI if you've got advanced clinical knowledge and things like that. But if you are a coder, they're always going to ask for experience. So you want to get in a position that's going to utilize your skill. And that front desk position, secretary position, is going to rob you of your skill, because you're either not going to use it, or you're going to be using it, but you're going to be using it and not getting paid for it. And you should get paid for it, because as much as you think, well, I'm going to do my time. I saw somebody else's post. This other person has a degree and was suggesting and telling people to find volunteer positions in coding. I don't think so. I do not think so. Nobody gets into this field to be a volunteer or to put their time into just giving it away for free as a coder. It's different when you're doing volunteer work for the associations. You know what I mean? That's something different, because that's you giving back to the profession as a whole. That's not you giving away your skills to an employer who can pay you. Okay? And I'm going to keep saying that, because I think people need to be reminded that you don't need to be doing charity work when it comes to coding, because that is a trained skill that you have, that you either paid for or that you went through and, got a scholarship or whatever, but it still required your time. I don't think people understand the importance and how precious time is. The gift of time is one that you can give to something or someone or a purpose, and you can never ever get that back. So for the people who watch my channel and who watch my show at 7:30 Central Standard Time, or 5:30 if you're in the Pacific Coast, 8:30 if you're on the East Coast, and you show up to my shows and you listen to my my videos, that to me is a gift. It's a gift to have people who tune in to the channel and give me their time, because again, you are spending time to learn about something or to listen to my message and things like that. And that's a wonderful gift to be able to give to somebody. Okay. And so I appreciate that. But again, when you're looking at these jobs and you're out there, you want to avoid those two positions like anything that you can. Okay. Because again, it's not going to use your skill. Scheduler, patient scheduler. Now, I will say, just like medical secretary, front desk is very important, so is a scheduler. Scheduler is a very important position to have. However, again, it doesn't require you to have medical coding knowledge. So that's working beneath your skill, because you are a skilled laborer. You are a skilled person who knows how to, manage the codes and things like that. So you're not going to want to spend your time working in scheduling, because scheduling is basically like working at a call center, right? I worked at a call center before, and that is not the most fun job in the world, because people, just like behind a keyboard, can be whatever they want to be. On the phone, they can be whatever they want to be. They can have you an attitude. They can give you an attitude or whatever. And it's the same thing. So that's going to send you running for the hills. You don't want to spend time in a position where that's not what you want to do. All right. You want to give your time and spend your time in a place that is going to help you learn more. And that's not going to happen in scheduling, okay? And again, if that's where you want to go, that's what you want to do, you're really kind of taking the long way around, all right? And I've seen people do that where they say, well, I want to do all the different positions so that I can know all of these things. That's sort of living in fantasy land, because don't you want to just get into the work? And the more you avoid getting into the coding and starting your first job, even though you're scared, the more you avoid it, the harder it's going to be to actually, when you do start, to actually understand what's going on. The closer you can get to, from the time that you got your certification to getting your first job in coding, that's what you want to do. Because anything else is going to be like, I'm the one who gets messages from people that says, well, Blue, I got my certification last year and I was working in, the front desk, and all of a sudden I got this interview for a medical coding position and it's a year later. So, and then they're panicking because they don't know what to do. So you spent an entire year not studying, not going over your books, not trying to refresh your memory or keep that stuff in your mind. You know what I mean? Like that, it's a waste of money then, right? You just wasted money on a credential or credentials, because some of you don't listen when I tell y'all not to get more than one in the first 2 years. And I tell you this for your own good, okay? Even if you think, oh, well, if I get the CPC and the CPB, that way I can have options. The CPC also tests you on reimbursement. So, you know what I mean? Like, and you're just making yourself spend more money. That's the thing I'm trying to get y'all to understand. These businesses are a business. They are going to sell you whatever they need to, because that is their business model. I want you guys to think and think logically, all right? I'm not against education. I think education is wonderful. I love education. However, I think when people don't know, or they don't do enough research on what they actually need to start, which is get one certification and start applying for coding positions, right? And not look for that instant gratification, like getting jobs in the front desk or secretary or, in patient scheduling. You know what I mean? Those are instant gratification things, because you're getting a job. Okay, you feel like you're doing something now, but it's not in what you need it to be in, right? Which is the coding, okay? There are positions out there. There are. And sometimes they're not going to be listed as medical coders. Sometimes it's going to be listed as medical records technician. Sometimes it's going to be, revenue cycle technician. You know what I mean? It's different. So you really have to go through and look at the key words, and you've got to do your research and find out the alternative names for coders, okay? So those are 3 positions that you want to avoid. Now, I will say this also. There is risk adjustment coding. Now, I always hurt somebody's feelings every single time I talk about risk adjustment. I'm not trying to hurt your feelings, but I do want you to think about something, okay? Risk adjustment is just diagnosis coding only. It is just diagnosis coding only. That means you are not using CPT, you are not using ICD-10 PCS, you're not using modifiers, none of that. And while risk adjustment is very important, it is also very important for you to be mindful about how much time you are spending in risk adjustment coding. Risk adjustment coding is great to start, but not to stay. I've seen people who say, Blue, I've been a risk adjustment coder for 4 years, and I'm very bored because all I do is diagnosis coding all day, but I'm so scared to go apply for other positions because I don't have CPT experience, I don't have ICD-10 PCS knowledge either, and they haven't been studying. The whole thing that's going to set you apart is the person who studies continually, even though they have a different job, versus a person who is not studying and is going to be lost. And then that is going to be their the only thing they're going to be able to do. And then they start panicking about it. And some employers won't count risk adjustment experience as experience in coding. I've seen it on the job listings, not all of them, but I have seen them say, if you've only coded for PT and OT, if you've coded for risk adjustment, this does not count as experience, because the codes that are used in PT and OT and in risk adjustment, they're very limited. And with risk adjustment, it is just diagnosis coding. And with PT and OT, there's only so many procedures that they do. And they do have a wide range of diagnosis codes, obviously, that they use. But again, it's not going to be the person who's going to be that well-rounded coder that's going to get all that experience in ICD-10-CM, in CPT, and adding modifiers, and evaluation and management, ICD-10-PCS, all these things, right? So just make sure that when you're looking at these job listings and you're looking at other alternative positions, you're not going for something that is not going to require you to be a coder, okay? And you're not going to volunteer your skill for free, because that's another thing too. When you're volunteering your skill for free, the person's going to basically get what they pay for. So if they're paying for you to be in the secretary position and they say, oh yeah, by the way, we're going to have you do the coding as well because we know you're a coder, and that way you can get some practice. It doesn't necessarily guarantee that there's going to be somebody that can audit those encounters that you're coding. And how do you know if it's absolutely correct? Especially if they know that they should have a coder, but they don't have one on staff, but you happen to be so happy to get a job as a secretary and being able to do the coding too. Who's going to tell you if it's right or wrong? Right? You need that mentorship. You need somebody there that's going to understand about coders and what they do and what is right, what is wrong, and that kind of thing. So think about that too. Getting that experience doesn't necessarily mean that it's going to be quality experience. Doesn't necessarily mean it's going to be correct. And they may say, well, we always charge for these codes, and these codes have never let us down. But meanwhile, if you're looking at the documentation, maybe it doesn't match up. Okay? Who are you going to ask? It's going to be on you. So avoid those positions that are going to take advantage of your skill and not pay you for it. Okay? Don't do it. It is not worth it. And if they say, oh yes, well, we'll write you a letter. Oh, I'm sure they will. But what happens if you're actually doing this stuff and you're doing it correctly, and all of a sudden they start making more revenue? Do you think they're going to want to let you go? You know, you just worked for them for free and doing another position, so they got more than one position out of you. And that's where people get stuck. You know, they can get stuck in those positions. And it's the same thing for like release of information. Sometimes people will get into that, trying to get in. There could be a better segue in by going through release of information. However, it's not going to require your coding skill. It's going to require like records knowledge and things like that. So that's going to be something a little bit different. And that's not really where you want to devote your time. But getting back to the risk adjustment, if you are going to go in risk adjustment, again, make it a very short stay. Because even if you get like 4 months in or 6 months in of risk adjustment, it's going to give you exposure to the electronic health record. It's going to get you knowledge of looking at the record itself. So that way you can learn how to spot the diagnosis and that kind of thing. So that's really going to help you in your other positions. But again, keeping your time there very limited and continuing to still apply for other jobs is really going to help you. Because some people get very excited because, oh, I can work from home and I can do all this if I'm doing risk adjustment. But again, guys, there's two sides to the coin on that one. And you got to be very careful, and you have to, again, limit your time with risk adjustment. You can do it, but limit your time. You know, and again, like I said, I always end up hurting somebody's feelings. Somebody always writes me and says, you don't understand. I'm a senior risk adjustment coder. I don't care if you're the Easter Bunny risk adjustment coder. It doesn't matter to me. What I'm saying is the truth. People get out of coding for CPT and E&M and ICD-10 PCS, and then they lose all of their skill. You don't want to lose your skill. It's very easy to lose your skill. Okay, that's all I'm saying on that one. But the other thing that I want to talk about too, when you're looking for jobs, right, and you're trying to get into these alternative positions, and you're looking at getting into something in the hospital, don't just look at the hospital trying to get in. There's other places like, the urgent care centers, they need coders. Nursing homes often need coders as well. So dialysis centers often need coders too. So those are other alternative places where you can actually look, all right? But again, if you're not looking around and you're just sort of like being very, like, this is the only way we can go, you're gonna miss out on a lot of opportunity. But again, avoiding those places that are gonna give you that instant gratification of, oh yes, I just got a job and I'm gonna take any job. Yes, you should take any job, but it needs to be in coding. All right, it does need to be in coding, and you need to be flexible when it comes to, you know, what you're willing to do as far as like being in-house or being remote. I always tell you guys, when you're starting out, you do not need to be remote. It does not matter your reason. It needs to be that your first job needs to be with other people so that you can have that camaraderie and you can have that connection with other coders. They can help you, they can mentor you, and you can be in a place where they can answer your questions, because you may not always know how to ask the question. So just make sure that you're flexible in that, and don't be so stubborn and hard-headed that, oh, I only want to code remotely, because that remote coding will come later and it will come with time. Just give yourself a chance to get experience in-house first before you do those kind of things. Okay, so, and obviously if you're willing to get a front desk job or do any of those other things, you're obviously willing to go and work at a place. It's the same mentality you have to have when you are applying for jobs as a coder. Okay, so that's just my advice anyway. So avoid those jobs. Don't just apply for them because you're just trying to get your foot in the door. It's not going to use your skill. You have to look for positions that are going to use your skill. And check out my other videos where I talk about alternative jobs for new medical coders, because those are great segues into getting into coding, and they are going to use your skill. So you're going to have time to build your skill in those other positions, but just not these, all right? At least not the correct way as you should. Okay, just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.